Welcome to Grow For It. It's a podcast for small business owners, managers, and professionals. The goal is to give me a chance to work with the space between your ears, on your mindset, to help you focus on the things that really matter to your success. I want to enable you to concentrate on pursuing your vision, setting meaningful goals, and engaging in the day-to-day activities that will have the biggest impact. Thanks for joining me. Well, welcome back to this episode of Grow For It. Today I've got a husband and wife pair. They're actually local veterinarians here in Louisville, and I wanted to bring them in because they have actually recently launched a new practice here in town. And I want you to get to meet them, and we're going to talk about their practice and some of the learnings and surprises that they've had as new business owners. And it's a really interesting story with a great couple of people. So at this point, I'm going to introduce the owners of the Dogwood Veterinary Clinic right here in Norton Commons over in Louisville's East End. And I've got Dr. Katie Franklin and Dr. Chris Franklin. Katie, Chris, welcome, guys.
Thanks for having us.
Thanks for having
Absolutely.
us.
Good to have you guys in today. It's an interesting business. I mean, we've had veterinarians, all through Louisville. A lot of people have grown up with them, but this is kind of unique. A husband and wife team. I don't think I've ever seen that before. So I've got to ask the question. There's always a story behind this. How did you guys meet?
So Chris and I, we met in veterinary school at Auburn. Every year they have at the Alpha Psi fraternity, which is a veterinary professional fraternity, they have a party to welcome the new students. They call it the Summer Splash. So that's where Chris and I first met. He was in his last year of vet school, and I was in my first year.
The party's a little bit of a just getaway. In vet school, you get very toned in on schoolwork and studies and clinics, and people have a hard time kind of letting go of that and relaxing a little bit. And so that first party we met, and nothing kind of stemmed from that. And then came back at Halloween, we had met again. And ever since then,
The rest is history.
We've been together.
That's awesome. I mean, there's always a story there somewhere. So congratulations on that. Obviously, you took one of the easier majors in school. I was a marketing major. I can't tell you how grueling that was. But so let me ask you this: why veterinary medicine? What was it about that profession that kind of attracted both of you?
So I grew up in veterinary medicine. Both my parents are veterinarians, and so watching them grow up, we had tons of pets, had puppies and horses, and I had always dreamt of being a veterinarian like they were. Towards the end of high school, I got a little bit scared at the science classes and was worried that I wouldn't be able to handle the course load in college. But once I got to UK, I tried out chemistry and ended up actually doing very well and ended up being a chemistry major. So got right back on the path of going to veterinary school.
That's awesome. I mean, just once in a while it fits, and it's just, people have a knack for certain things. I couldn't imagine doing that path. Chris, what about you?
I never really thought much in high school about what I was going to do. I was too fixed on football and athletics, and academia just came natural to me, fortunately. My parents were all teachers. I was around it my whole life, and it was easy for me, so I focused more on football. But two of my really good friends growing up in high school, Dad was an equine surgeon. And so I was over at Root and Riddle, a big equine hospital in Lexington, Kentucky, as much as I could be, shadowing and watching. And ever since I started doing that, I knew this is what I'm going to do. I'm going to go to undergrad, and I'm going to play sports, and then I'm going to go to vet school and be a surgeon, an equine surgeon. And you never know where life's going to take you, and that's where I thought I was going to be. And then today I look at it, and I look back and am thankful that I'm doing small animal. But that whole path all the way through vet school was going to be equine until now. So
Lexington's a good place for that, right?
That's right.
I mean, obviously.
That's
right. But again, just for people that are wondering, Chris actually went to Murray State, so he's a fellow Murray State racer. You played a little football down there too, didn't you?
I did. I played quarterback down there for 5 years. Honestly, when I got to college, I realized that sports were going to end very quickly for me. When you get around all those athletes, you realize how small your world is in high school.
Yeah.
And I started focusing more on academia and focusing on the chemistries and biologies and pre-vet, preparing myself to go to vet school at Auburn.
I mean, that's awesome, though, that you were able to balance that. A lot of people go one track or the other, and it's...
and I tell people, it's funny you say that. I tell people, really what balanced that for me was not, I don't think it was strictly me. I mean, I have to take some of the credit for it, but I think a lot of it was athletics and the structure in my life from that.
I mean, you had limited time. You were very
right.
regimented, and that was the one thing about the student athletes. A lot of people don't, I guess, understand is that they're being pushed.
Right. Right, absolutely.
That's fantastic. Well, okay, so fast forward a little bit. You guys both graduated from Auburn, and now suddenly, last year, 2019, you decide to open up a clinic of your own practice. Kind of walk me through that decision process, because a lot of the people that listen to this podcast, or they're entrepreneurs, or they're people that are thinking about starting a practice or thinking about opening a business. So there's always that tipping point. And you guys had an interesting journey in terms of why your own practice and why the current location in Norton Commons. I mean, walk us through that a little bit.
So whenever I was in vet school, I did you don't get a lot of business classes in vet school.
Yeah.
I mean, unfortunately, I didn't take a lot in undergrad. And so I started kind of trying to picking out electives in vet school of business ownership and things like that, because I knew that's something I was interested in. I like the leadership side of it. And so I actually graduated and did an equine internship at my friend's practice there in Lexington that was my mentor. And I realized very quickly that it wasn't the lifestyle I wanted. I wanted to own. That's a very long track in equine medicine. Me and Katie had recently gotten engaged at that point. And so I headed back down to Auburn and started working in small animal and realized how much I loved it. And at that point on, when my first boss down there, I knew that I wanted to own my own practice. Katie was still in school.
Yep.
I was very ambitious. A few years into that, I started looking all across the Southeast to buy. I wanted to buy a small practice in a pretty nice community. I didn't want to get out in rural America. I was looking for a good location because I knew that was important. And we were really looking hard for a couple of years, and then I came up during hunting season to visit Katie's family, and was walking around Norton Commons.
Yep.
And as I walked around there, I started looking at the demographics of Norton Commons and paying attention to what was around, 5-mile radius, how many vet clinics were there.
A lot of new developments outside of Norton Commons even.
And at that point, I can remember driving back to Auburn. Katie's still in her senior year at Auburn, and thinking, how am I going to bring up to her that we need to move back right close to her, right down the street from her dad.
I mean, you were in Georgia, right? You were
Georgia,
in Alabama?
South Carolina. We looked down in Florida.
Yeah.
We looked all across the Southeast. Tennessee. We looked really hard at a place in Tennessee. I almost even visited the place. But the thing that held us off of buying a practice was corporate veterinary medicine buying up a lot of small practices.
Yeah.
The price was getting out of reach for
Right.
individuals. They were paying far above what individuals were paying for existing practices. And so we found out after starting to do the research and finding Norton Commons and deciding, okay, we're really going to look into this, we could build and start our own for cheaper than we could buy an existing practice. Now, the only caveat to that is you've got no clients.
Right, exactly. It's all startup at
That's
that
right.
point, and you better have a good business plan.
That's right.
Katie, what were you thinking about this time? I mean, he's going all over the Southeast. You guys are talking about this, and suddenly, oh my gosh, right down the street from my parents. I mean, that's got to factor in a little bit.
Yeah, well, my parents, I've watched them be practice owners my entire life. And the funny thing is, I had kind of fallen away from wanting to own a practice initially just because I knew the workload that it would take to own a veterinary practice. So I always said that I just wanted to have an ambulatory equine practice. It was going to be me and my truck, and that was it. But whenever Chris and I were together and started talking about things, it felt like something that we could really undertake together and that we could complement each other in building that. So when we were looking for practices across the Southeast, I mean, I really let Chris take the initiative on that. And when he came to me and said he wanted to build in Norton Commons, I supported him on that too, because Chris has really taken the reins on a lot of the responsibility in the practice. And I feel as I am an accessory to him and helping him to manage that. But, I also wanted to have time with our children, and
Right.
we just had a son 5 months
I
ago.
was going to say congratulations. So you're launching a new practice, you're building a new location, obviously, and now you've got a new kiddo and the clinic pup.
Exactly. Yep.
pup.
So you got your hands full.
So I just knew that it was going to be a lot of responsibility to start this practice, but it was always Chris's dream, and I could see us doing it together and had a vision of making a practice that could be different than your standard veterinary experience. So when he came to me with the idea of building in Norton Commons, it really started to unfold of what we could build there and just a unique type of practice with a different client experience. So, I let him take the reins and jumped on board.
I've got a couple more questions about the practice itself, but obviously, we're recording this. This is going to launch in April of 2020. People are thinking about this coronavirus, so I want to let you know if you're listening to this episode, we're going to talk specifically about the coronavirus and potential risks to pets. We'll address that in a little bit, but let me just come back to this journey overall. Okay, so you're opening up. Initially, you guys were both thinking equine, and suddenly you're small animal. Where did that transition come from, or what did you think in both from a hey, I think this is interesting, but also from a business perspective? How did you evaluate that transition?
Well, I'll tell you, I mean, just to be an open book,
Yeah.
Finances definitely played a role in it. The equine industry it's a great industry. It definitely rolls with the economy for sure, because the people who own horses, whether it be pleasure or race horses, are very dependent on how they're doing financially. Whereas the pets really have turned into family members.
Sure.
And I didn't really think that I would love that practice. And I don't mean that I mean, we have a pet that I would do anything for right now. But what I mean is that would I enjoy work every day? Would I enjoy going in, talking to clients, and taking care of their dogs and cats that are essentially another member of their family? And it really, I got lucky, to be honest with you. I went all equine, and I realized that I want a family of my own. And I realized that lifestyle wasn't something I wanted. I have a huge student debt load, and I had to make plans on what I was going to do to be able to support my family,
Right.
as well as take care of the finances that I've undertaken for education. And I went back down and I got a job in small animal, not really knowing what to expect, down in Auburn. And really, the first week I realized, wow, I'm lucky. I never planned on this, and I absolutely loved it. And medicine comes kind of like academia. I love medicine. I love the difficulties of it. I love the gray area of medicine. Nothing's black and white and easy. But I really love talking with clients and helping them understand what's going on, the things that we're doing, having a relationship with our clients. And that's really what grew into me enjoying and only wanting to do small animal after that point, and having no interest in going back to what I had planned on originally.
And Katie, how was that transition for you?
Yeah, so I actually still practice equine medicine right now, and it's something that I know it's not something that I intend to do forever, because the work-life balance of equine medicine is extremely difficult.
Is there a lot of travel with that as well, or?
There can be. Luckily for our practice, we mostly work at Churchill Downs, and we just take downtime in the winter when the horses are gone. But it is true what Chris said about in equine medicine, you don't get the same client relationship. You can, depending on what type of equine medicine, but I'm in a racetrack practice currently, so I predominantly work with trainers. A lot of times I've never even met the person who owns the horse. But the kind of client relationship you build in small animal is certainly not something that we're achieving at the racetrack right now.
Right.
But I feel that through my participation with Dogwood and working on the client communication and the social media outlets and helping, to build the culture of our practice, that it can help me kind of fill those needs, because I enjoy, communicating with our clients as well. But small animal, it definitely has some advantages as far as work-life balance, and just maintaining a lifestyle.
And I think that's what we're all looking for. I mean, you're an entrepreneur. You're a team of entrepreneurs, and it's easy to get out of balance sometimes, especially in the startup phase. Those first 3 years can be really, really hectic. So
Right.
Congratulations on jumping on. You guys have both mentioned independently that client relationship, that communication with the clients, and that is so refreshing to hear, because a lot of times, especially for humans in healthcare, I mean, obviously, you don't always have that kind of a relationship, but even from the minute you walk into your guys' location there, and for those that are familiar with Norton Commons, it's in the South Village, but it's right across the street from 502 Bistro. So very, very easy to get to, right over there by the firehouse and all this other stuff. But just a fantastic location. But the way you guys have built that out, I mean, it almost looks like a living room when you walk in. I mean, it's very comfortable, very nice, lots of open windows. I mean, whoever came up with the overall design, you did a great job. And you've carried that through in your website. I mean, if you go to dogwoodvetclinic.com, obviously that shows that attention to detail. Love your logo, by the way. Pretty cool.
Thank you.
And then your Facebook and Instagram as well. And you guys are doing just a really nice job of using those platforms to build the practice, especially early on. but that shows that attention to the relationship. You guys are really putting out some, I mean, I think for Valentine's Day, you had the pup dressed up and giving away some stuff and things like that. I mean, it's a great communication path.
Yeah.
Absolutely. I mean, when we first came up with this idea, that's what we said as our foundation is, veterinary medicine is medicine.
Yep.
Let's step away from that, and what else can we do to provide another experience? And the experience that we love and the relationships that we grew with the clients that I had in Auburn, that's what we wanted there. We wanted the foundation of Dogwood Vet Clinic to be about the client. And once we took care of the client, we were taking care of their pet. I mean, that just came naturally. It was second nature. Once you take care of the individual and you communicate with them so that they know what's going on, because we can't communicate with the pet. We have to have somebody that we can communicate with and understand, and that they can understand what's going on, and that's what we built this around.
Well, I'm sorry. Go ahead, Katie.
Well, sometimes veterinary medicine, a lot of times we think about puppies and kittens and well visits, but it can be stressful, and there can be some difficult things that you need to navigate. And, clients can be emotional when you're giving them bad news about their pet. And so for us to be open to them and for them to feel like they can trust us, and to feel like they really understand everything that's going on so that they're not confused and that they can feel as secure as they can through the whole process, was very important to us.
Well, I think that shows. I mean, not only when you walk in the front door, and you've got a large staff. I mean, everybody's friendly. I've been there. I mean, everybody's really nice and friendly, and it's so clean in there. It's awesome. But then you guys show me the back room, and it's almost got an ICU feel to it. You've got glass all around so you can see who's doing what in what area. You've got the dental cleanings over there we'll talk about in a few minutes, and the surgical areas. And I mean, it's just put together so well to where it's just open and it just feels comfortable, especially when you do come in those emotional moments. Whether something's going on with the animal, you're not sure what it is, or maybe you're frazzled because it's a new pet,
Right.
a puppy just chewed up something,
Right.
or you're at the end of life stage with a pet, which is also a very emotional time for an owner.
Yeah, we wanted, really, you mentioned the openness of how you can see everything throughout the back of the practice and how all of our staff is so friendly and welcoming. And I think that just openness and welcoming is just kind of some general themes that we've tried to incorporate in our practice. And we have really talk to the staff how important it is to make sure that every client really feels welcomed and feels at home there. And the staff they all have great relationships with each other, which we love, and we try to, keep the place to just be as positive and uplifting as possible. And so we've really been happy with how we've been able to achieve that so far.
No, you guys are executing really well on that. And then that goes into kind of what makes Dogwood, Veterinary Clinic different. And you guys have come up with some different services and some different offerings that I think are just, I don't know, they seem unique. I've never heard other vets talk about it. I've had animals in the past. My family, has had just about every animal you can think of. And what you guys are doing just, to me, seems a little unique. I mean, for instance, you have a concierge service. Katie, do you want to talk a little bit about that?
Yeah, sure. So the concierge service, one thing we like to clarify for people is this does not mean that you have to pay an initial fee to be a client at Dogwood. The concierge service is an additional service that you can choose if you would like to participate in. So what it does is it gives you access to a cell phone to Dr. Chris or myself 24 hours a day. So if you ever have a question or you have an emergency about your pet, you can reach us. So we will see emergency cases for our clients that are members of the concierge service, but those are the only clients for which we'll see emergencies after hours.
Well, there's also an advantage to that. So access is awesome. I mean, we all want access. But Chris, I think at one point you said that can also save you money if we determine over the phone it's not an emergency situation.
That's right. And just big picture, if anybody's ever been to an emergency clinic after hours, they know the costs that are associated with those. And it's not that they're always emergencies, but our pet owners, our clients, don't always know that.
Right.
And they're not expected to. They're not medical professionals, and they don't understand those things. So having that access builds back on our whole foundation of being there for our clients. And what that means is that they can text us a picture if they're concerned about something. They can call us and say, hey, this is what's been going on. Do I need to be seen? And we can help facilitate that. If they end up, let's say we're out of town, because we talked about a minute ago, our work-life balance, there's times that we're going to take Levi, our son, and go on vacation and enjoy a week off.
How dare you?
There's things, and it's funny. You laugh about that, but in the profession, some people think, "Oh, I can't go anywhere. I got a new business."
Yeah,
but we really are important. So the work-life balance, but just because we're gone doesn't mean that we can't answer that phone and say, hey, listen, this is something that's concerning. I think you do need to go over to Blue Pearl or one of the other emergency clinics and be seen. And then we'll facilitate with the doctors at Blue Pearl. That way, if it's confusing to you, if there's something you don't understand, or if you just want to talk about it, we're still there to talk.
Right, and you can talk the right language to the people at Blue
That's
Pearl,
right.
so they get the information in the way they can best understand it.
That's right.
And if they
outside of
have
the
any
emotions.
questions for us about the case, and we're probably going to be familiar with the pet, or we will because they'll be our client, then we can go over that with the doctors at Blue Pearl. But I do like to just point out that maybe you are not interested in the concierge service, and it's not for everyone, but great cases that it is good for are like young puppies that are loving to get into your kid's candy or get into toys that are left on the floor, and you get constant scares of a foreign body or vomiting and diarrhea. If you can reach us quickly, you can save some trips to the ER that way.
Yeah.
Also for older pets with chronic conditions that might have flare-ups that need immediate medical attention, or maybe you're not sure if your pet needs attention, those are good pets that would qualify for this service.
Well, beyond the concierge service, you also have a loyalty program, which is pretty interesting.
Yeah, so the loyalty program is a way that we like to reward our clients for being loyal to Dogwood Veterinary Clinic and for supporting our business. But one great way that I like to look at it is you're going to earn rewards just by providing your pet with the veterinary care that they need. So you'll accumulate rewards just for spending money at the clinic. For every $100 that you spend, you'll get a loyalty stamp towards our loyalty program. And then there are different rewards that you can turn in those stamps and redeem them, like getting a free nail trim, or you can get money off of a dental procedure, or you can get $100 off of a future visit, just depending on the number of stamps that you have accumulated.
As you said, these are services you're already using and you're going to need in the future anyway. So it's a nice, again, a little give back, to the clients who are investing their money in the growth of your practice. I mean, that's fantastic.
Yeah, and just to throw a caveat in that, with what's going on right now, and everybody knows with the coronavirus stuff going on, and the small businesses that are concerned right now with the state of the economy, this is us saying support local. Not just for us, but we're
100%.
going to give back to you for supporting local businesses, because we do think it's very important.
Yeah, well, there's more of a personal touch there.
That's right.
You're not owned by the corporation. You're not controlled by the corporation. You guys are out on your own doing this, and that takes a lot of time, effort, skill, and nervousness from time to time. But that's a nice risk. Yeah, that's a nice give back. Chris, talk a little bit about, and this is something that I was completely unfamiliar with, but you have a service there, or a treatment called regenerative medicine. And on Facebook, you've got a little blurb about that in the services button. But talk to us really about what that is and why that's so important.
Yes, sir. So, it's a small part of what we do at Dogwood. It is, but it's something that's different. There's not many people that are doing this. It's very new to the profession. In the equine industry, it's been around for a while, but regenerative medicine is simply stem cells and PRP primarily. PRP is platelet-rich plasma, and this is a way for the pet to heal itself with its own body. All we're doing is facilitating that. So stem cells are taken from the bone marrow and concentrated down. PRP is taken from the blood and concentrated down, and then it's reapplied to conditions such as osteoarthritis, ACL tears in dogs, which is known as the CCL in a dog. That's a ligament in the knee. Right. For hip dysplasia, back injuries, a number of other soft tissue injuries. And this is something that's done in the clinic. We process it right there within about 10 to 20 minutes, depending on the procedure that's being done. The patient is sedated for one procedure. They don't have to get the blood drawn or get the stem cells collected and then come back another day and have the procedure done. So it's one sedation. And the things that this does is it is, one, cheaper. Some of these procedures, like ACL ruptures, there's a lot of new studies in dogs that if they're partial tears and not complete tears, that some of these is showing promise for healing without having to have surgery. And, we used to think not long ago that if it's a partial tear, just go ahead and prepare yourself for surgery in the future. And that could have happened in 6 months, and now you're talking 6 months of recovery at the year of that pet's life.
Not to mention the pain and the anguish that you put the pet through to begin with.
That's right. And then that's the other thing is, a lot of these procedures, hip dysplasia and things like that, it's amazing. With our dog, Hank, I tell people that story all the time. He's got bilateral hip dysplasia. He gets PRP and stem cell injections in his hips, and he's a different dog, running up and down the steps, jumping in
Wow.
the car, things like that. So it really is amazing. Less pain for the pet, less anesthetic periods, and then
And basically, they're going home shortly thereafter.
That's right. That's right. And then there's rehab afterwards, but
Right.
that can be done at home. It can be facilitated by rehab facilities as well. But it's just a lot easier on the pet. And in the long run, if it is successful, it's a lot cheaper than a lot of these surgical procedures.
Yeah. And can that be done on both cats and dogs?
Absolutely, absolutely. The trick to it is to identify the problem, because you really have to isolate these procedures. So you need to have the problem identified. And just to kind of reiterate and talk about stem cells and PRP real quick, people know about stem cells in human medicine, and I think it was probably 10 to 15 years ago, there was a big push on stem cells, and people were talking about growing kidneys and growing ears and things like that. And we've learned a ton since then that's not what stem cells are good for. Stem cells are not good at saying grow this organ or this thing to replace it. Maybe in the future that's something we figure out, but stem cells...
Well, I've got a 3D printer for that, right?
There you go. Yeah, so stem cells, they're very differentiated. There's many types of them. There's many cell lines of them, and so it can get very confusing. But the basic mesenchymal stem cell, what it does is it promotes growth factors and pro-healing anti-inflammatory factors to the site. So if we put that in there, then it's going to attract all those other cytokines to help with the healing.
So you're going to take it out of somewhere, bone marrow. You're going to take
That's
it out
right.
of a leg or something.
That's right.
And you're going to, I guess, reintroduce it at the site of the injury? Is that
That's
kind of the
right.
idea?
So we'll process it down
Yeah.
right there so that it's concentrated stem cells or PRP, and then it'll get re-injected sterilely right back into that site. And so the body does that itself.
Yeah.
If you sample joint tissue from a ruptured ligament, you'll find stem cells in there in very low numbers because they have to make it their way to that area. So if we can concentrate those and put them there, then we're just
You
facilitating the
accelerate,
process.
yeah,
That's all we're doing.
absolutely. Now, that sometimes is seen as an alternative to a normal surgery, but within the clinic, you also do a full range of surgeries. You want to kind of talk
We
about some of those
do.
procedures?
One thing that I pride myself in and that I love is orthopedics.
Mm-hmm.
We are not board certified surgeons, but we did see the void in veterinary medicine where you have two options. You don't do anything, or you go to the board certified surgeon. Sometimes it's cost prohibitive. Unfortunately, in veterinary medicine, we do not have insurance for a lot of our pets. There is insurance available, but it's
Right.
not widespread right now. And so when somebody gets hit in that 7 to 8 year old dog with the ACL rupture that's completely ruptured and surgery is the only option, you've got an option of going to a board certified surgeon or nothing. We're trying to fill the void. And so for a lot cheaper, than a lot of the board certified places, we can do a lot of orthopedic procedures. We also do soft tissue, abdominal procedures, bladder stone removals, elective spay and neuters on dogs and cats as well. But it's a service that we're trying to offer that kind of fits the void of, hey, listen, not everybody can go here. And if you can, that's great. Go see the board certified surgeon. But if it's not an option, come talk to us. We'll talk
Right.
about the other options as well.
And so basically, I would walk in and be able to take advantage of pretty much anything else that another vet would be offering in the local area.
That's correct.
Yeah.
And on
a
top,
general veterinary practice.
yeah, and on top of that, one of our other things that we pride ourselves on is our dental care.
Yeah.
We've learned a lot about dentistry and small animal medicine over the past probably decade or so, and how important it is to overall health of the pet. And we got lost for years in just what we see as the problem. And so you looking superficially at your pet's teeth, or you say, "Man, my dog's breath stinks," or something like that. You really don't know what the underlying reason is.
Right.
And so all of our dentals is just like you go to the dentist. They get ultrasonic scaling. It's not just getting scraped with a hand scraper. We're actually doing ultrasonic scaling. We're polishing those teeth, and then we're taking dental radiographs to make sure that there's nothing underlying underneath the gum line that is concerning, that could be a problem in 2-6 months or down the road, so that you don't have to go under another anesthetic procedure.
And these are
have
the
that fixed.
X-rays that if you or I walked into a normal dentist,
Same
it's
exact
same thing.
X-rays.
So
Same
you're able
exact-
to look at the bone, how the teeth
That's right.
is interacting with how the tooth, I guess, is
Yeah.
interacting with the bone if there's a problem there.
That's correct. That's correct. And it catches these problems before they're clinical problems, before your dog stops eating and loses weight, before that tooth is falling out or gets abscessed and ruptures an abscess in their mouth and you smell that. If we catch those things early, think of the pain that we can prevent that pet from being from.
And again, that goes for cats as well, right?
Absolutely.
Yep.
Absolutely.
Interesting. Now, the other thing I really like about this website, though, is you do have an online store. which is pretty cool. And right about now, that's kind of important. Katie, you want to tell us a little bit about that?
Yeah, sure. So we do have an online store where you can, if you have a prescription from us, you can order your medications. And also during this time of the coronavirus, we're also offering medication delivery to your home. There is a fee associated just depending on where you are at, but we want our clients to be able to get the medication that they need for their pets. So if you have any questions about getting the medicine that you need, please feel free to call our clinic. We don't want anyone to be without during this time. In addition to the online store, we also have something called Purina Vet Direct. This is a place for you to order food for your dogs online. So it is great right now. It gets shipped straight to your door. We have a clinic code that you can put in if you're ordering from Vet Direct. And if you have any questions about what food that Dr. Chris would recommend for your pet, you can also feel free to give us a call and ask any questions about that.
And so again, especially if I live out in a rural area, having a direct ship is a nice thing.
Absolutely.
But if I'm here and I just don't want to get out, or I'm unable to get out, an elderly person right now, I've got a pet, love the pet. I don't really want to fight the shopping center or the big box pet stores or even the grocery stores right now.
Right.
That's a nice alternative.
And think about it this way as well: is you're getting somebody who has medical background giving you recommendations, not just somebody who owns that pet store. And so emailing me or calling the clinic, and we'll talk to you about what we recommend if there's been issues. There's a recent FDA report talking about heart disease in pets related to nutrition, and that report it's still under investigation by the FDA. But from 2018 or 2017, there was 3 cases of cardiomyopathy that was suspected to be related to pet food, and then in 2018 there was 320. So that big spike came right after the whole boutique exotic grain-free diets came out. And for years, even us as veterinarians have been saying, yeah, it's fine, feed that. Yeah, it's fine, feed that. Because everybody was going to the pet store to get their food, and we weren't thinking about it. Well, now we're getting burned from it. And so most people have seen that. You can go to FDA's website and see that study. Still under investigation, up to date. As of last April, there's 550 cases so far. We've had 1 case of this with heart enlargement with a dog on a diet at our clinic. And so we spend a lot of time talking about nutrition. And this is just a way for us to see what is your pet feeding, what's your pet eating. And if we can see that in their medical history and there's a recall or a problem, hey, we've got a chance to call you. So having everything in our records, we know what's going on. Vet Direct comes straight from Purina's warehouse. It comes next day, Monday through Thursday, if you order before noon. So there's no running low on foods, last minute. And it's a really good service, and there's no question about where it's coming from. It's coming from their warehouse. There's
legitimate
no third
sources,
party,
healthy sources,
like that. That's right.
Tested sources.
Right.
Now, as part of that relationship with your clients, as part of that, again, you guys are just doing it a little differently than we may have experienced in previous just trips to the vet and previous relationships with other vets. You also do house calls. That's kind of interesting. How does that program work?
Yeah, we do. We do house calls for our clients, and anybody that wants to be a new client, we'd be happy to talk to them about house calls, dogs or cats. This can be for sick appointments or well appointments, old or young. There's a chance that if they are sick and we think they need to be hospitalized, we'll have to transport them back to our clinic, and we're happy to do that for you. Especially in this time when people don't want to be getting out, especially if you've got other health issues where you don't want to be out in the public or coming into the clinic. But we will do these house calls to do any type of annual exam or sick pet exam. And this is year-round. This isn't just right now.
Right.
We do this year-round, but we're just trying to highlight it now because some people are concerned about getting out, as they should be.
And I would imagine there's probably an extra fee for the house call, but that's logical. I mean, that kind of makes sense.
There is, and it's nominal, and it's simply for us to be able to have a technician with us when we come out, and we have to pay them, and then the transport time and behind that.
But house calls are great for people who say you've got a really large dog and it's difficult for you to get them in the car and transport them to the clinic, or maybe your pet might be more comfortable in their own home for the visit. So even though we are featuring them right now, anytime that you would like to have a house call, it's something that we offer.
We again, just a nice extra service as you guys are building this business. I mean, you guys are checking a lot of the boxes. We always talk about what is that unique selling proposition. And here's another one. Here's just another service that's available at Dogwood. So
that's right. And there's a lot of things we can do with that on top of that. I mean, just a couple weeks ago, we went out and we were pulling blood on a dog just to run back to our clinic and run it. And we can call you in 20 minutes with the results if there's something concerning going on. So there's a lot of things. I didn't talk about that with, we talked about surgery and regenerative medicine, but just basic lab work. preventative care lab work to make sure that we're catching problems early is another thing that we provide, and that's able to be done in the clinic. It's able to be sent off to the lab, but we can come to your house so that you don't have to get out for those things.
And maybe I've got multiple dogs or multiple cats. I mean, I would think, again, that kind of a service would be really helpful.
Right.
Instead of trying to cram them all in the crates and get them all in the truck or all
Or
in
make
the car.
multiple trips or whatever it may be. Yeah.
Yeah, so that's been okay, guys. I have been dying to ask this. The coronavirus, obviously, everybody's talking about it. Everything's going on, and I know pets are susceptible to viruses. I mean, parvo was, I think, a virus that we heard a lot about, years ago, and there's a big outbreak of that. Are we at risk for the pets? Are the pets at risk of this coronavirus, and kind of what should we be aware of?
So, as far as this particular coronavirus, COVID-19, that we're worried about right now with this pandemic, you don't really need to worry about your pets contracting this virus. There was one dog that tested weekly positive for coronavirus in Hong Kong. Now, this dog was living in a household with a person who was infected with coronavirus, and the samples were taken from nasal swabs. We can't confirm that the samples that were found on those swabs were from active virus or if they were just from fragments of the virus. There's no indication that this dog was shedding the virus. So there is no evidence, according to the AVMA right now, that pets can contract coronavirus, get sick from coronavirus, or transmit it to other people or animals.
This particular coronavirus.
Right. Are there other? I mean, what about stuff like the flu and things like that? I mean, where is that potential for crossover, human to pet? Where does that come into play?
Yeah, so just to back up a
We
little
always
bit,
think the
there
other way
is
around.
coronavirus, and so people get caught up with what's going on right now. There's been coronavirus in our pets for years, for decades. I mean, there's always been coronavirus around. That's a family of viruses, right? And so there's coronavirus in birds, there's coronavirus in pigs, there's coronavirus in cows, dogs, cats. I won't get into the particulars of each and every one of them, but
Right.
most of them cause either gastrointestinal disease or respiratory disease. And so any virus, and this is a concern, and everybody remembers bird flu and swine flu that went around.
Right.
Any virus that we need to remember can mutate. So COVID-19 is suspected to be a mutated coronavirus. It's a novel virus. We've never seen it before, but coronavirus has been around, so it came from somewhere. So these viruses can mutate, and this kind of stems off the importance of vaccines. If we can prevent these viruses from surviving in our pets and us, then we can prevent them from having the ability to mutate. And that's the important aspect of it, because could coronavirus, COVID-19, begin to infect our pets? Yes, if we don't get control of it and we don't do the things we should be doing, it absolutely could.
And it adapts just perfectly. I mean, there's a chance.
That's right. And the thing to remember about, kind of to go off of what Katie said about pets, up to this point, we do not think that pets can be infected with or shed the virus. It's unsure right now, but we don't think that that's possible. There's still fomites. And a fomite is simply anything that the virus can live on. So that's why it's important to wash our hands, because our hands are fomites to carry virus. If we touch something that has the virus on it and then we transport it and touch something else like our children, then we can transmit that virus. So the pets, if we snuggle up and hug on our pets and we sleep with our pets and we have the virus and then our grandparents watch our pet, they could definitely transmit the virus over to the grandparents' house. So any fomite, that can happen. That's why it's important that we stay away from our pets and have somebody else take care of it if we are feeling ill. And that goes for any virus. Now, we can go into flu, and there's dog flu now. Everybody knows about dog flu. In 2017 and 18, there was an outbreak in Louisville of canine influenza. We have a bivalent influenza vaccine that we use against dog flu, and it's very important to prevent. Now, remember, the last outbreak was 2018, and so we start to lose track of that. That's almost 2 years ago now. And are we going to see it anymore? Well, if we stop, if we get lax on doing that vaccine, that's when we see it again. But if we stay on top of it, we prevent mutations, we prevent reinfections and things like that. So it's important to remember that vaccine and good hygiene is going to help prevent these things from continually recurring.
Well, that's perfect. And so having that normal relationship with your vet, that normal preventative medicine, those checkups, those whether it's semi-annual, annual, how often they need to be, especially when a puppy or a kitten's young, there is a reason you have all of those puppy updates and
That's right.
puppy checks and kitten checks and stuff like that. Again, to get them started out properly and to make sure they don't. I guess, become susceptible to all these other problems.
I mean, classically, we think of puppies as being more susceptible for parvovirus is a very well-known virus and that it can make puppies very, very sick. But that's not to say that it can't affect older dogs as well. Yes, puppies are more susceptible, but luckily at this time, I mean, most of the population does vaccinate their pets and does help keep that controlled. But if we weren't, you would be seeing a lot more older dogs that were getting infected with parvovirus if it was more widespread. So again, that's one of the reasons we really push for the importance of regular vaccination in our pets.
No, that's fantastic. And eventually, I think we're going to get ahead of this coronavirus, and eventually this goes the way of all the others where, okay, we know about it, but we're really not in that surge. Let's talk about seasonal tips. I mean, eventually we're going to get into spring. Eventually the sun's going to pop out. But even with that, there are some things. I mean, obviously with April coming up, Easter is here. There's some risk to your pets just being around just due to things that we do normally to celebrate the seasons.
Yeah, so there's some things that we don't think about a lot of times with Easter time coming that might be dangerous for our pets. One of which is lilies are very toxic to cats. So if you do have lilies in your house around Easter time, we recommend keeping those in an area where your cat cannot get to them. Also, in addition, we have those Easter baskets filled with grass that's very fun for the cats to want to play with and could cause something we call a linear foreign body if they are ingesting some of this grass. So we encourage you to keep those away from your cats as well.
And you said that could lead to a surgical procedure, I guess, when we were prepping for the show.
Yeah,
I wasn't aware of that.
Yeah, so linear foreign bodies are basically as if an animal eats something that is like a string or linear in shape. So it can cause the GI tract to plicate around that linear object and to cut through the GI tract. So that would make it's a medical emergency that can cause sepsis in the pet.
Wow.
So we encourage you to take extreme precaution with those linear objects. And then also there's lots of chocolate and candy inside the Easter baskets, and we don't want our puppy dogs to be getting sick eating too much chocolate.
Well, and I guess that does kind of reach back to the coronavirus topic in that the kids are home from school, people are around, there's probably the chance that more and more candy or small objects, whatever, are going to be left around, especially while everybody's home from school. So again, your pets might be at a slightly higher risk right now. So again, be vigilant, right?
Right.
Absolutely.
So toys on the ground, socks on the ground, things that are really tempting for our dogs to want to eat if they are bored and not getting as much activity as they usually are. Those are things to always be careful of.
Well, and then as we move outdoors, as summer comes around, we start grilling and doing all these other things. I mean, Chris, you had talked a little bit about the risk for, was it pancreatitis and different things like that?
Yeah, pancreatitis, sunburn, which is something we don't think about in our pets. But as we get outside, we go to the lake, we spend more time grilling, things like that. You need to be cognizant of chicken bones and those high-fat foods that don't seem to bother us, but when a 20-pound, 40-pound dog gets a hold of a whole chicken, there's a lot of fat in that, and it can lead to pretty significant problems like pancreatitis, the grease that's associated. The chicken bones can cause perforations of the bowel, and most people will say, and I hear this a lot, oh, my dog's eating bones, steak bones, and this and that. It's never a problem till it is. When it is a problem, then you have to go through those extensive procedures and surgeries and risk of, the pet not making it through it, depending if it's caught early enough. So paying attention to those things. And then on top of that, sunburn. A lot of people don't think about it.
This is something that surprised me when we were prepping for this episode. That
yeah,
really...
what's the dog want to do when he gets out in the sun? He turns over on his back and lays out in the sun where he's got no hair on his belly, so no protection from the sun and the UV rays. And you do have to think about it, especially our white-coated dogs.
Yep.
Those dogs that are at increased risk.
Pink noses.
Pink noses.
Yep.
They can get the same things that people get, melanomas and other skin tumors, and you have to be cognizant of that. So talk to your veterinarian about what type of sunscreen. Be careful with aerosolized sunscreens as they can inhale them and cause other problems, but you definitely want to pay attention to those things.
And coming back to the pancreatitis, you said, again, high-fat food. So if I'm grilling and I cut off a piece of the fat off the steak and throw it to the dog, not always a great idea, I guess.
Yeah, I mean, it's like I said there just a minute ago, a lot of people do it. When I grew up, I can remember those things happening, and there's, quote unquote, oh, I've never had a problem. Until you do. And when you do, people say, man, I just never thought that. So we just try to educate people to be cautious. They get a little piece of chicken, it's probably going to be okay. They get a little piece of steak, it's probably okay. But you really want to think about leaving, those hamburgers or chicken legs and wings sitting on the grill and walking away. and the dog getting up there and eating every one of them.
Yeah,
And
or on the counter or wherever.
Yeah, be cautious of those things. The other things you want to pay really close attention to, and we get caught up with everything that's going on in the economy right now and going on the news and things, is it's starting to warm up. And that means that fleas and ticks are coming out. Fleas carry tapeworms. Those can affect our kids. The ticks carry Lyme disease, or Ehrlichia, anaplasmosis, all these other dangerous diseases in people and in pets. So having them on a monthly preventative for fleas and ticks is important. And then not forgetting about heartworm disease and intestinal parasites. Heartworm disease shortens the pet's life if it's not caught in time. The treatment for heartworm disease is very dangerous. Although we take better precautions now, it is still dangerous, and it's easier just to prevent. $8 to $11 a month for heartworm disease, you can prevent against it. And then intestinal parasites, a lot of people don't think about, and there's not many people that go to their pediatrician or doctor and they say, hey, well, make sure your pet's on heartworm and intestinal parasite prevention because your kid can get it. You know, we sleep with our pets. We're close proximity with our pets now, and all these are zoonotic, meaning that we can pick these diseases up from our pets. So just simply preventing against them once a month will remove all that risk.
And these are all the little things that an experienced pet owner may know, but especially a newbie. You know, you just had a dog for maybe a season, or you're just kind of getting into it, or a cat. It's all these other things that nobody ever really told you about. So, you know, again, having a good relationship with a veterinarian who places a value on good communication, who provides a lot of information on Facebook and Instagram and all that. I mean, you guys are doing it right. I really appreciate it. Any closing thoughts from you guys?
You know, I mean, the biggest thing right now is I think everybody just kind of take a deep breath with the state that we're in right now, and it will pass. You know, we have to work together, be cognizant of what you're doing, of where you're going right now, and don't forget about family members and your pets as well. And just remember that, you know, there's your veterinarian or us, we're all a phone call away, and to help you through any of this stuff that's going on.
No, I appreciate it. Guys, I really want to thank you for your time today. I know you guys have a busy practice. Congratulations on building it. Friends, if you've listened to previous episodes, I mean, obviously we talk a lot about business topics and startups and concerns and having that right mindset. And part of what I've seen these two do is, you know, they really kind of define that vision of what they want, not just for their business, but also the importance of that work-life balance. And again, I think if you're going to step into this realm of being a business owner, being a business operator, you've got to really understand the full impact that this thing has. If you're going to devote the time, you better be sure it's something you want to do. And again, make sure it's something that you love to do. So other things that you all have done that Katie and Chris have done well is develop some unique services, some unique selling proposition. And if you're thinking about launching a practice, you're thinking about starting your own business, what are those things that really are going to make you different so you do stand out from the crowd and break through that white noise that's out there so that people notice you and take note of you? Those things are important. And most important, at some point, you got to have the courage to simply start. You've got to have the courage to just start going from dreaming to setting a vision to implementation. And it's one of the biggest steps you'll ever take, but it can also be one of the most rewarding in so many ways. So friends, when you're ready, let's grow for it.